Welcome to the official release of the 2013 WEDI report. I'm Jim Daly, chair of WEDI, and I want to welcome members of the press, the contributors to the 2013 WEDI report, and other attendees to today's official release. I also extend a special thanks to the Honorable Dr. Louis W. Sullivan, MD, who led our executive steering committee in creation of this report, and whose vision as Secretary of Health and Human Services in the early 1990s led to the creation of WEDI.
As the honorary chair of the executive committee for the 2013 WEDI report, I want to welcome all of you to the public release of the 2013 WEDI report recommendations. I also want to thank the WEDI Foundation for the invitation to serve as honorary chair for this 2013 report. In 1991, as U.S. Secretary of Health and Human Services, I asked Bernard Tresnowski of the Blue Cross Blue Shield Association and Joseph Brophy of Travelers Insurance to provide to us business advice on how we could improve our system to transition from a paper-based system to an electronic system. This we needed to improve efficiency of the system and to reduce costs. Their leadership then, along with efforts of many volunteers from the healthcare industry, resulted in the 1993 WEDI report.
In the actual development of the WEDI report, there were four primary areas that we actually identified: patient engagement, payment models, data harmonization exchange, and innovative encounters. Just a quick background on what those are. Patient engagement means, for us, improved access to pertinent information that the actual patient is going to need. Payment models was looking at requisite business and information exchange requirements that will be required in order to support new business models and payment models. Data harmonization exchange is dealing with administrative and clinical data, and how do we get these to actually talk better, link them, capture it, and share the information. And finally, innovative encounter models. And quite frankly, we're talking about mobile. How do we leverage these devices that we know are going to actually change the face of healthcare as we know it in the future, and is already doing so?
The Healthcare Leadership Council represents all sectors of healthcare. So I can say with very great certainty that the findings and principles that Devin just discussed and that you will find in this report in much greater detail really will have an impact across the entire continuum of healthcare. And now I believe that the role of the WEDI report that's being issued today is very similar to the WEDI report in 1993. It is going to serve as an advisory bridge for us as to what we are capable of achieving in the very foreseeable future. How do we get from our healthcare system today to the future? And I think this report will really act as a great guide for us to get there.
Together, this set of recommendations really presents the industry with a reasonable and more critically, really, an actionable pathway.
The four topics covered in the 2013 report are very timely, and WEDI's work to coordinate the many efforts across our industry is a substantial contribution to our shared goal of improving the effectiveness of health IT.
We have so much work to do, and we're all doing it. But this report and this project allowed us to provide a structure and a roadmap for moving forward. And so where HIMSS may have efforts that are ongoing with our stakeholders, we also have very collaborative efforts with everyone at the table. We move forward with the commitment to do that in conjunction with the roadmap and the spirit of collaboration that was established during this project, and with the recognition that we're all headed in the same direction for the same benefit for the nation, for the patients, and even for ourselves.
WEDI has been a transformative force, and we think that this report very much continues that trend. The recommendations provide a framework and a roadmap that I think is well thought out and actionable.
My name is Robert Tagalicot. I'm the director of the Office of eHealth Standards and Services at the Centers for Medicare and Medicaid Services. But I'm here really to represent the administrator, Marilyn Tavener, in our work with WEDI, and she definitely would like to convey her thanks for this opportunity to work with WEDI and you, Dr. Sullivan, and with all of you as part of our public and private partnership and that commitment to that partnerships in developing a roadmap.
WEDI has been a great partner. Certainly as this roadmap and recommendations have been developed, we at ONC have also been garnering throughout the Department of Health and Human Services an update to the Federal Health IT Strategic Plan. So it's been very helpful to make sure that we had some synchronicities and looking at some of the same issues as we go forward.
This report acknowledges the opportunities to use technology to improve healthcare delivery and financing. It also acknowledges that we need to address those barriers within healthcare that stifle innovation and prevent data from getting to the right place at the right time. This report provides an avenue to engage all stakeholders in developing solutions that will help us overcome those barriers.
We participated in the original 1993 WEDI report, received a lot of value out of that for our customers and our member providers, and are pleased to participate in the 2013 report.
The WEDI report really does establish a thoughtful and viable framework for public and private collaboration.
Just as the 1993 WEDI report became the roadmap for electronic business solutions for healthcare in the 1990s, the 2013 WEDI report and recommendations that are being released today will serve as the roadmap for the road ahead that will lead to greater efficiency and improved healthcare delivery in those years. I regarded the implementation of the 1993 WEDI report roadmap as a civic duty, a duty for its time, that brought together the public and private sectors to identify and implement solutions. And it is my hope today that the healthcare industry will adopt that same spirit in the 2013 WEDI report's recommendations. The 2013 WEDI report recommendations also reflect collaboration of public and private sectors to identify solutions for electronic healthcare information exchange in the years ahead. In that sense, the 2013 WEDI report can be considered as a continuation of that effort that was begun here some 20 years ago.